Dr. Ara Deukmedjian, CEO and founder of Deuk Spine Institute here in Melbourne, Florida. We're located in the Space Coast of Florida. That's the East Coast. We're about 15 minutes from Kennedy Space Center, where the space shuttle from NASA used to launch and land. And currently, SpaceX program is being supported. Deuk Spine Institute has been here for 16 years, and we perform the most state-of-the-art spine surgery available in the world. There are no spine surgeries we cannot perform. We do them all. We can do them all. We don't do them all regularly because though there are many different ways to skin a cat, there's only really one or two best ways to do it. So spine problems are categorized into different categories of problems, and some of the more common categories are symptomatic herniated discs, symptomatic spinal stenosis, which is narrowing, fractures of the spine or instability, and deformity. Deformity means when the shape of the spine changes. And fractures are obviously problems with the bones of the spine. Many people don't realize the spine is not just bones. It's actually bones and joints between bones. And then, of course, ligaments. The muscles I don't really count as part of the spine. But spine problems, for the most part, the most common spine problems are problems with the disc. They affect the disc, which is a joint between the vertebral bodies. 80% of the weight of your body that goes through the spine, it goes through the discs. 20% goes through the facet joints. All right, we're going to get started. It's Dr. Deukmedjian. Are you ready? All right. So this patient was supposed to have 2 discs fixed during his first surgery, but we had some issues with sinuses, so we had to stop. And he's back now, and he's ready to have his second disc fixed, which we never got to in his original surgery. So we're going to be doing L4-5 today. Everybody in agreement? Left approach. We're on the left side. We're going to get started. I'm going to numb your skin up like we did last time, okay? You're going to feel a little stick and burn. Don't get upset. Most important things, don't move your body around. Just lay still. Are you comfortable? All right, we're going to get started then, and just don't move, but let me know if you're feeling pain, okay? You're going to feel a little stick and burn, and that's expected. I'm sorry about that. You have anybody watching your surgery today?
I don't believe live, but we will watch it recorded.
Okay. All right. Just give that a minute or two to settle in. How's our blood pressure?
117.
All right. Definitely moving in the right direction. Okay, remember, if you feel discomfort, you say ouch, and I'll give you some more numbing medicine, okay?
You got it.
All right. So, as I was going back to talking about different kinds of spine surgery, you know, the spine has different conditions that affects it. Anything from degenerative conditions that affect joints to trauma that causes ligamentous injuries, joint injuries, bony injuries, to tumors and infections. Fortunately, tumors and infections are rare. We don't see a lot of those. They're less than 1% of spine conditions. The most common problems with the spine are with the joints, degenerative conditions. Let's get a shot. And so that's what we do most of our treatments for is joint problems. The joints include the facet joints, the discs. All right, let's get a lateral, see where we are. Monica, The little radiation tags on my lead and other people's lead, they just keep falling off. Find a way to secure them. Falling off. Find a way to secure them better, please. All right, let's try to, it looks like L4-5 is not terrible, but let's see if we can get the L5 pedicles lined up better. I think I'm going to start a little bit lower than where we are. Any way we can get that down a little more? What are you giving him? What have you given for blood pressure? How much? We. Anything else we can do besides labetalol? Huh?
Last time you mentioned that was very vascular in that area.
Uh-huh. Okay, well, you know what? I love it. Thank you for sharing that.
I think you were a bit surprised last time.
Oh, yeah? Thank you. See, the patient is part of our team, our operative team. You know? There aren't many surgeries that are done on people where the patient is actually part of the operative team. You know, people hear about brain surgery being done with the patient awake, helping out. And this is spine surgery being done with the patient awake, helping out. Now, I'm not the first person to do awake spine surgery by any means. All these lumbar endoscopic cases, for the most part, are done with the patients awake, no matter who does them. So it's pretty common. But it is nice to have the patient reminding the physicians about their individual differences, right? I love it. Thank you for your help. Well, if things go well, you're going to be asleep very soon. So I expect them to go just fine. But I want to make sure we get where we need to be. Are you comfortable still?
I'm comfortable. I can definitely feel it, but I wouldn't say
Shot?
it's excessive pain.
Yeah. Well, we're right near your facet joint. That's probably why you're feeling it. So it's not altogether unexpected that you're going to be feeling a little something right now. Shot? Because we're pretty close to your bad disc. That's for sure. Everybody's in agreement? L4-5, correct? Where do you feel it? Not down your leg. In your back, basically. Is that better now? A little bit. Let me know when it gets better, okay? Just take your time. Try not to move. You're doing great, by the way. Much better than last time. So the last surgery we did, we started with L5-S1. I got that done, but our patient had a lot of secretions coming out of their sinus, so we ended up, just to be safe, we ended up aborting the surgery for the second disc. I've never had a complication with any of these surgeries in 14 years, but the most likely complication would be a problem with the airway, you know, or ventilation or oxygenation. So when it comes to the airway, if things aren't just perfect and right, I'm going to stop and reassess, see what we can do to make it better. In the case of the secretions, we tried to make it better. We gave medication to reduce secretions, but it didn't really work. Okay, you feeling better? Now our patient is pretty in tune with his back, so I told him after the last surgery I couldn't get the L4-5 done. I said, go home, heal up from your first surgery. And he did. And then he came back and he said, you know, I can definitely notice the pain lower down is gone, but I still have some pain a little bit higher up, which of course is L4-5, right? L4-5 is higher than L5-S1. We fixed L5-S1. So we fixed the lower disc by his butt crack, but we didn't fix the higher disc. So he definitely started having more pain at L4-5. He kept coming back, right? You were telling me, oh, I'm still feeling the pain, still feeling the pain. So we decided we were going to go back today and we were going to fix L4-5. Do you still have that pain? Yeah, but you don't have it right now.
I don't have it right now, but the muscle spasms has been really, okay, yeah, right, yeah, okay.
You feel that? How bad on a scale of 1 to 10?
Yeah, you're pushing 9.
9. Is that where you typically get your back pain?
Yeah.
All right, so for those of you who are paying attention could see I didn't tell him I was going to inject. I was kind of tricking him by having a conversation and distracting him. But he knew what I was up to, right? And we just reproduced his typical pain. All right, when you wake up, we'll be done, sir. Sean? Yeah. Go ahead and count from 1 to 100 out loud for me so I can hear. I can't remember how to count from 1 to 100, so I need you to remind me.
Let's start with 1.
Perfect. Sure. Sean?
4,
Keep going.
5, 6, 7,
Sean?
8,
You see the guide wire, Louise?
10, 11, 12.
Shot. You're doing great. Keep counting. Nice and loud. Shot. You're doing good. If you get to 100, we don't pay the anesthesiologist. You're doing great. Keep going. All right, so we make an incision. As a matter of fact, it's right where his old incision was. Keep going. You're doing great. Keep going. Shot. You can see the guide wire. You're doing great. Everything's perfect. Lay still. All right, he's feeling a little discomfort, so we're going to wait a little bit. You're doing good. Just relax. You're doing great. Nice deep breaths. Oh, you can see the tip of the dilator is at the back of the facet joint at L4-5. I can see the L5-S1 disc space. We treated that last time. Jordan's done a really nice job of showing us the proper anatomy. I can see the pelvic bones, the sacrum, nicely. We don't see the hip joint, which means we're in the right spot. We're centered at L4-5. You can see the guide wire in there. May I proceed? Okay. So we're going to bring our dilator down over the guide wire. This is the more stimulating part of the surgery. Shot. So we're in the foramen. And you can see right where the wire goes in the back of the disc, there's a dark line there. That's the tear. And that dye, the black dye, is coming out of the tear and highlighting the tear. Now you shouldn't see a black line through the back of the disc because the black line is basically dye leaking out through the tear. Shot. And it was right in front of the dilator tip. So now we're going to advance the dilator through the tear. Remember, this tear is the source of his pain. So this is the most painful part of the surgery for the patient. I'm not going to like this, but I have to do it. Once I get through the tear, now I actually have the tear in the center of my field of view, and that's as I pull my tubular retractor backwards, I can clean the tear up with the laser. So it's important with the technique that you actually introduce your dilator, your needle, hence your guide wire, and subsequently your dilator through the tear that you want to repair. Shot. All right. Tip of the dilator is in the middle of the disc. It's perfect. Shot. Now we need to bring our tubular retractor, which is right at the back of the disc. We need to bring it into the disc. Shot. Now our patient is from out of town. He doesn't live far. He's a few hours away. Shot. And this is a person who really did not want to have open back surgery like most people. They don't want their back slit open, the bones removed and ground down to make holes in the spine so the surgeon can get to the part that's causing pain, which is the disc. Didn't want metal in his back. He didn't want a fusion. That was another option offered to him. So he wanted a surgery that would repair the disc naturally, let it heal naturally, and not have any metal or anything unnatural in his body. So this is the only surgery in the world that does that without damaging the spine. The Deuk Laser Disc Repair. Okay. We do take questions throughout the surgery, so if you're watching and you want to ask a question, ask it. Don't be afraid to ask a question. That's one of the reasons I'm here. I'm here to answer questions for people. We do these broadcast surgeries so that people can learn. All right, grabber. Unfortunately, there's a little bit of oozing, so we have there's some herniation right there. We have the visibility isn't perfect. Laser. Now there's the annular tear at 12 o'clock. I know it's a little difficult to see and I apologize. There's not much I can do about it. There's a little bit of, like he said when I was putting him to sleep, he was very astute. He said, Dr. Deuk, the last surgery when I watched it, afterwards I took the video home and watched it, because we give all of our patients the video of their surgery if they want it. And he said, Dr. Deukmedjian, when I watched it, I remember you were saying something about my having a disc that has a lot of bleeding. And here we are at L4-5 and the same thing. He has very vascular discs. Most spinal discs don't have a blood supply in the center of the disc or in the inner half of the annulus fibrosus. His does have more blood supply, and the reason for that is that what's the problem?
No, you want to see the last patient, right? The
Yeah, of course I want to see the last. No, don't send him home yet. I want to see him. Want to come check on him. You can take him to the bathroom. Let him go to the bathroom, but don't let him go home. All right, so the reason people have blood supply into their disc is because of the chronic inflammation from the tear. And the tear is right there. You can see a blue line. It's like a fault line. It's not supposed to be there. In a normal disc, there is no tear in the annulus. The annular tear is the beginning of the disc herniation. It's what starts the disc herniation. And disc herniations then result in degeneration of the disc over time. The degenerated disc is a collapsing disc. So imagine if you have a problem with your tire on your car, and the tire is collapsing, right? It's going flat. That's the other way of saying it. So you're getting a flat tire. The reason your tire is getting flat is the air is leaking out of the tire. There really is no other explanation. Now, 99% of the time, the air is leaking out of the tire because you have a puncture of the tire. You have a damage to the rubber, and there's a hole, and that hole is allowing the air to leak out. Well, the disc is no different. It's just like a tire full of air for a car. The only reason the jelly leaks out, which is your air, is because there's a puncture, and the puncture is the tear in the annulus fibrosus. Believe it or not, most surgeons don't know this. Most people don't know this. But this is exactly why herniated discs happen. It starts with an annular tear, just like a flat tire starts with, standby laser, with a tear in the annulus fibrosus. Then the jelly in the center leaks out through that tear, just like the air leaks out of a tire. And the disc will collapse just like the tire will collapse. And over years and years of the jelly leaking out and the tire collapse, or the disc collapsing, it becomes a degenerated disc on MRI. It's what it looks like. So you want to know the truth? The truth is the Deuk Laser Disc Repair can prevent you from getting degenerated discs. How? Because the reason why the disc keeps collapsing is that the tear never heals. So more and more jelly squeezes out. When you do this surgery that I'm doing, and only this surgery I'm doing, you can repair the tear. I repair it, of course, not you, but you can choose to have it repaired. And once it's repaired with my Deuk Laser Disc Repair treatment, the jelly won't leak out anymore. Unless, of course, you re-injure it. And, of course, the re-injury rate after my surgery is 1%. And I've told people that before. 1 in 100 patients will re-herniate their disc. And I can tell you it's always because they do something they're not supposed to do. Now, what they do, sometimes we don't know. But in roughly 1,200 laser surgeries, I've now had 12 patients with recurrent disc herniations where I operated. So that's a 1%. Is that a big number? No, it's a small number. Most surgeons have a higher recurrent operation rate at the area they operated, the disc they operated, than 1%. As a matter of fact, 1% is the lowest number out there for any spine surgery. It's unfortunate that it's not zero, but the truth is that patients don't always listen to me and my restrictions. There are various restrictions I have. One of them is after a lumbar Deuk Laser Disc Repair, you cannot lift anything over 25 pounds for 6 weeks. You must go back to work and keep your lifting under 25 pounds. Second, you cannot bend at your waist to pick things up from the ground for 6 weeks. So we say no bending at the waist. Bending at the waist could push another herniation from the center of the disc out through that annular tear that I've just debrided, and it's supposed to be healing. And it will heal. It'll come back together and seal. But it won't heal and seal if you're bending at the waist, picking things up. It won't heal and seal if you carry heavy things. So activity restriction is very important after the Deuk Laser Disc Repair. There's the tear. This is the annular debridement. What I'm doing right now, I'm debriding the annular tear, and I'm going to allowing it to heal on its own naturally. Now the healing doesn't happen in the operating room. The healing happens after surgery. Luis, why do I have such a blurry view? There's nothing on the lens, right?
Correct.
It seems like it's just down here for some reason.
Yeah.
It's really weird. So the healing of this disc is something that takes a full year to completely heal. One full year to heal. But during that year, you have to be careful to not overdo it. And I can tell you exactly, I always tell my patients, tell me what activity you're interested in doing, and I'll tell you when you can start resuming that activity. I always give my patients my cell phone number so they can call me if they have any questions. They don't have to try to reach me through my answering service or through my practice. They can just reach me directly and ask me questions. I don't want my patients re-injuring themselves after surgery. But again, it does happen, and it happens 1% of the time. That's my number, which is really a good number, by the way. Show me another spine surgeon who does surgery on people's backs or necks that has a better than 1% reoperation rate. Nobody does. Some of them it's 50%, some of them it's 5%, but nobody has a 1%. So 1% is a really, really good, I'm not calling it a failure rate because it's not a failure, because we were successful at fixing the problem, but just people sometimes do things they're not supposed to do and they re-injure the disc. So we just call it a reoperation rate, because that's really what it is. So I've got 5 minutes left. Doctor? Thank you. This is lateral herniation, lateral tear. I'm cleaning up here. Again, I apologize for the quality of the pictures. There's nothing wrong with your monitor. It's just a bad image because there's some bleeding from the end plates, which we knew. The patient actually warned me of himself just a few minutes ago and said, remember, I'm vascular. Boy, was he right. So that red stuff you're seeing is just red blood cells, aka bleeding. Now, how much bleeding are we talking about? We're talking about a minute amount of bleeding. If you prick your finger with a pin, like a diabetic pricking pin, and let it bleed for about a minute, that's how much blood loss we're having for the whole surgery. So it's almost nothing. It's certainly nothing to get concerned about. I've never had to do a transfusion on any of my surgeries, even the open ones, even the fusions. I take blood control of bleeding very seriously. A lot of spine surgeons don't, believe it or not. They don't really care. They just let the patient bleed. I know it sounds crazy, but it's true. I've seen it. I see it many times. You can see it in the results, their blood loss. Every surgeon has to report their estimated blood loss at the end of their surgery, no matter what surgery they do. And you can see, if you go to the literature on PubMed and you look at blood loss with spine surgery, you can see that most surgeons lose a large amount of blood during the surgery, which is, in my opinion, completely avoidable with the right operative technique, which goes back to why we broadcast our surgeries. We want to show you the right operative technique to minimize blood loss during spine surgery. Part of it is blood pressure control. That's a big part of it. That's why I'm always giving the anesthesiologist a look over. They don't like it, but I don't really care if they like it or not. I'm not here to make them happy. They need to make me happy and make my patient happy and safe. So a good surgeon will always pay attention to the blood loss during their surgery. That's the end of the tear right there. Just about done. Another few minutes. This was a big one, by the way. It's a lot bigger tear than I thought it would be. It's a beefy tear.
We have a question.
Oh, joy. What question do we have from our audience?
One of our viewers, John, on Facebook asks, I have problems with my right leg going out on me when I walk. An MRI shows inflammation in the L5-S1 area and some in L4. Would this surgery help me?
Hi, John. Thanks for asking your question. So John is saying that his leg is going out on him when he walks, and the MRI shows some inflammation at L5-S1, and he wants to know if this surgery would work for him. The answer is yes, most likely it would, as long as your leg is going out on you because of a pinched nerve or inflamed nerve from a herniated disc, which is what you're saying, was what I believe you're saying is the case, but I would need to verify that myself, and I can do that by reviewing your MRI. And then I could give you an opinion that's based on more fact than just a conversation that we're having right now. I need to see that MRI with my own eyes. So what I would say to you, if you want to know the absolute truth, if the surgery will work for you, is just submit your MRI for me to review, and I'll do that for you. No charge. We can have it reviewed probably this week and have an answer to you by this week, if you can get it submitted today. Anybody out there watching that wants an MRI reviewed on their lower back or their neck, all you got to do is go to mri.deukspine.com. That's on our website. You can upload your MRI, and I will personally review it. It's all done digitally. And then Sean here will contact you and tell you what I recommend as far as treatment. So to answer your question, yes, if you have a pinched nerve, irritated nerve in your MRI, which it sounds like you do, would this surgery work? The answer is yes, it should work for you. This is exactly why we do the surgery, for exactly your problem. A herniated disc causing leg symptoms and back pain. I hope that answers your question.
And we have another one to follow that up from another viewer on Facebook. Tasha asks, I had a revision surgery at L4-5 and L5-S1 and now have extreme pain going down my right leg and hamstring. Why would that be?
All right, so we have a viewer who says she's had surgery and I believe revision surgery, which means she had a second surgery, and she's still having extreme pain going down her leg. The answer is, very simply put, the problem has not yet been solved. It's not uncommon for surgeons to go in there and do their very best for their patient, but a lot of times their very best isn't good enough to fix the problem. Deuk Spine Institute is different. We don't do surgery unless we know we can fix your problem. So Tasha, I would recommend you get your MRI and submit it to the same link that I just mentioned. Sean will post it. It's mri.deukspine.com. Let me look at it and I'll give you my opinion, okay? We can even do a video conference for free over Skype, and 15-minute video conference. We don't charge for it. So all that MRI review and the video conference are free, and you get my free medical opinion. Sorry you're still in pain, but unfortunately it's pretty common to hear that story of people having multiple back surgeries and still having pain. We can cure that pain about 99% of the time for you. It just takes making the right diagnosis and providing the right treatment. Unfortunately, a lot of surgeons are not capable of doing that. They don't know they're not capable, and they certainly won't tell you they're not capable, most of them. But the truth is they're not capable. It's just like if I were to put you in a Formula One race car right now and put you on the racetrack, you're not capable of going fast in that car. It takes a very, very special set of skills and highly trained individual to be able to drive that kind of a race car. So same thing with spine surgery. Just because they have spine surgeon after their name doesn't mean they're going to fix your problem, unfortunately. If that was the case, then we wouldn't have anybody with back pain or leg pain anymore. Every person would be cured. So that's the God's honest truth. Whatever they did, they didn't fix your problem, but it probably is fixable. And the reason I say it's probably fixable is because you're having pain. And if you're having pain, that's an indication there's still a problem. And it's a fixable problem, like I said, 99% of the time. So just get your pictures to me so I can look at them. By the way, if you're watching this surgery, Deuk Spine has a Facebook group. If you like going to Facebook, the group is called the Spine Surgery Support Group. And at the Spine Surgery Support Group, you're welcome to come and ask questions and learn more about the spine and how it works, or if there's a problem, how we can fix it. So it's a free support group. There's no charge. And there's the fat from the epidural space at 12 o'clock. It's kind of getting in my way a little bit, so I'm going to zap some of it out of the way. Also, the Deuk Spine Institute has a free app. You can download it on Apple or on Google for Android. So whether you use Apple technology or not, you can download our free app and you can interact with Deuk Spine Institute and me, ask questions, get answers, submit MRIs for review. Even if you don't treat with us, it's okay. We'll still help you. You don't have to treat with us for us to be able to help you. A lot of people we can help over the internet. and guide you. Maybe you're getting ready to have a back surgery. You have some questions. Maybe the surgeon didn't explain everything to you all the way. We could probably try to help out. Use us as a resource. All right, 1 minute. I'm just working laterally here, cleaning up the tear laterally. Pretty big disc injury. All right, pretty much done. See the nerve root? It's right in that fat there. Everything is looking good. Last 10 seconds. You guys ready? All right. Laser off. Let's take a look at the incision that we did this surgery through. This is the smallest surgical incision possible in the world right here. 7 millimeters. There is no smaller incision. And notice how we come from the side rather than straight in the back. All the other spine surgeries are done right where this line is in the middle. Surgeons go down, they find the spine, and then they make holes in it to fix it. But the holes they make aren't good for the spine, they're bad for the spine. But they can't fix the spine without making holes. So that's just part of every spine surgery. Except for the Deuk Laser Disc Repair, we come from the side, so we don't make any holes in the spine. All right, everybody, great job today, ladies and gentlemen. I'm going to take more questions if you have them. I'm going to head over to the conference room and answer them. Also, our first patient that we did earlier is chomping at the bit, wants to go home. So I'm going to go say goodbye to that patient. We may actually do a video as well on him and post that for you. But go ahead and type your questions up right now and I'll answer them for you.
All right, we're clearing for takeoff. There we go. This is how normally I'm running, about like this. I've got my arms out. Like I said, after about an hour, it was getting excruciating pain just going across my back. And 30 years ago, I used to run motocross, cross country, did a lot of different things. But one of the biggest things I did was had a bad motorcycle wreck during that and did an end over the handlebars and basically planted my head straight into the dirt, and it jammed top of my neck, messing up 3 herniated discs. So I've been dealing with that for 30 years. Seems like a long time for me once you're living it. And finally, it just got to be so bad at the end, especially when I go to drive the RV. As soon as I hold my arms out for the matter of an hour, just the way the steering wheel is positioned on the RV, it just sends excruciating pain across my back, gets down to my hands where my hands are numb. Me and the wife, we have to pull over, rest stop. After 2 hours, it's incredible. I just got to get up, take a break, shake my hands. Well, if you're going on a long trip, 2 hours don't get you very far. Just like lifting up this, I was having a hard time getting into my engine compartment. Just every little thing that you take for granted seemed to become a bigger problem and bigger problem as far as my neck. I went to Dr. Deuk's to try to get fixed, and he did an expert job. Looks pretty good. Fixed it all up for me. Went in through my neck, went around to hit the back of the spinal cord. I still don't know how they do it. Unbelievable. But no scars, didn't hurt at all. As you know, when I woke up, it was totally painless. My surgery was done on a Thursday. I went back to work Monday. Pretty awesome. Once I've gone to the Deuk Spine Institute, it's amazing. Once you take that pain level down, it's like, whoa, there's nothing. I mean, it's night and day. I mean, I just can't even describe it, how good it is. You know, I feel like a new man again. Now that I'm back driving the bus again, it is fantastic. Now we can get behind the wheel, drive for a good 8-9 hours, and then take a rest where I want to and not where I have to. What a difference. Fellas, I'm telling you right now, if you've got the pain I've got, you call me. We'll talk. Anybody can call me anytime. 321-403-8757. We'll talk about the pain. If you've had this, you're going to want to get rid of it. What a great place right here in Rockledge, Vieira, where we can get rid of it right there. I wish I had known this years ago, but I did Deuk Laser Disc Repair. It was great. My name's Randy Quick, and if I have anything else, I know where I'm going. I'm going to Deuk Spine Institute.
Okay, Dr. Deukmedjian, wrapping up our second Deuk Laser Disc Repair for the day. And our first patient that we did, the bilateral, his leg symptoms are gone. He doesn't have the weakness anymore. He's been up walking around in the recovery area. He's gone to the bathroom, and he wants to go home. So he's going to be in tomorrow. We'll do a testimonial on him tomorrow morning. He'll be back in the clinic at 9. He's agreed to do it tomorrow, and we'll see how he's doing tomorrow. This patient we just finished up today, just right now. This patient that we did the L4-5 on, now unlike the first patient, this patient's primary problem was back pain. And he would get horrible back pain right in the center of the back, in the lower back that is, at the L4-5 level. And he wanted it gone. So I determined the pain was coming from a herniated disc with a tear. We just finished repairing that tear with the Deuk Laser Disc Repair you just watched. And that patient, our primary goal is to eliminate his back pain. The first patient, primary goal was to eliminate the leg weakness on both sides. And so far, from what I'm hearing, talking to him in recovery, his weakness is gone. So we'll see how he's doing tomorrow when he's completely recovered from the anesthesia. He'll be in clinic, and we'll be broadcasting him. Other than that, do we have any questions? All right, well, hope you enjoyed the surgeries today. Again, I'm Dr. Ara Deukmedjian, CEO and founder of Deuk Spine Institute, here with Sean Hanneman, who's been running our audiovisual system and broadcasting and helping me respond to questions from patients and people out there on the internet who may have questions about their back and neck. Until next week, enjoy yourself, stay safe.